Dr. Webb, why pain management?
Well, everyone at one point in their life deals with pain. May be acute pain, may be long standing chronic pain. However, everyone at one point in their life deals with pain. And I wanted to be a part of the process that helps give someone back their happiness, their quality of life. And to be able to reduce someone's pain, to me, there's no greater feeling.
It's awesome. And most of what we do, what you do, excuse me, from a pain standpoint is non-surgical, correct?
Correct. Correct. We like to say interventional, non-surgical approach where we attempt to be a stopgate before someone needs surgery.
What are your feelings on people having surgery, particularly back surgery? What do you think about that?
Well, there are times when someone may need to have surgery. There may be an emergency where someone loses loss of feeling, someone loses the ability to control their bladder, their normal functions. Those become emergency situations, and surgery is definitely needed. However, chronic low back pain surgery, I believe, should not be the initial approach. There are many different ways to try to augment and reduce the pain, such as exercise, physical therapy, chiropractic therapy, water therapy, aerobics, yoga, many different means where we would like to say initially you can attempt to reduce pain in the low back. Once that is no longer effective, that's when I usually come in to the equation. And there are many different what we like to call interventional treatments to attempt to reduce pain. The one thing about surgery is that once you have surgery, um, and let's say, for example, hardware is placed, there's a rapid arthritis that takes place after the patient or after the client has surgery. And therefore, uh, more likely than not, an individual will still experience persistent low back pain. So we like to find different ways to try to overall reduce the pain and, if anything, prolong the need for surgery.
Very good. How do you feel about this push towards regenerative medicine and stem cell therapy as a means to heal versus some of the more traditional methods, such as we just discussed surgery, but also some of the more traditional interventional methods, which are, injection based or doing branch blocking, spinal cord stimulating. So, how do you feel about regenerative medicine taking more of a priority over some of these things?
Great question. I think the field of regenerative medicine is what I like to call the unknown. I think there's so many potential possibilities in regards to treating pain organically or naturally. I'm excited. Uh, if there's a way that we can reduce pain by using one's own body or using one's own, we like to say blood or PRP, if we could use that as an example. I think that it has an amazing possibilities, and research is ongoing as we speak, and every day there are new studies coming out to show that there is evidence to support using regenerative medicine.
What types of regenerative medicine are you looking to get into in this office, and what types of individuals would you consider using those types of things on?
Well, what we currently offer at Georgia Pain and Spine Institute is PRP or platelet rich plasma. Um, that is one of the most supported uses in the field of chronic low back pain currently today. Uh, there's some other treatments such as stem cell, which there is some controversy, but overall it's starting to get some acceptance in the medical community. Um, Other types of treatments that are what we like to say on the horizon are lipozymes and different ways to deliver uh, the regenerative treatments that could be beneficial, or different vehicles that could provide a means of regenerating all aspects of the body. So it's one of those things that we would say it's the story is it hasn't been completed yet, and I'm excited to see where it goes.
Very good. What's your favorite thing to treat in this office?
I would say my most favorite thing is what we would call failed back pain. The medical terminology for that is post-laminectomy syndrome, or frankly, individuals who have back surgery and have persistent pain, usually also with pain that travels down the legs in low back pain. Um, there are many, many different treatments to reduce pain. Specifically, spinal cord stimulation has been one of the mainstay treatments over the past decade. In addition, there's new treatments in relation to what we call dorsal root ganglion stimulation, and again, every day there are new treatments that are on the horizon. Um, we would like to say here at Georgia Pain Spine Institute, we would like to be futuristic and be on the cutting edge of technology, and so there are many, many different options available. We would like for you to come in, have an evaluation to see if there's a way we can help reduce your pain.
Nice. So, brand new office in the Decatur, city of Decatur, just I guess like a suburb or a subset of Atlanta. Why Decatur? Why here? Why build? Because you've been in Las Vegas, you've got some roots in some other areas. So why Decatur? Why come where it's greater?
Well, as we like to say, Decatur where it's greater. Decatur, Stone Mountain is home. I grew up in this area. I always said if I had the opportunity to come back home and practice medicine in the town, the area that raised me, that I would jump without hesitation. Also, the metro Atlanta and Decatur area is growing rapidly. There are many, many, many different individuals of different backgrounds that are moving here every single day. We like to joke that we're full. However, we are rapidly growing, and with that comes individuals that may need someone like myself, such as pain management. And I find no greater value in being able to help provide someone a better quality of life.
Have you ever had any pain problems yourself? Any injuries? Anything instances where you had to deal with pain personally?
I have. I've had a left shoulder injury for many, many, many years. That with rehab therapy and some conservative approach, I've been able to avoid surgery. I also enjoy doing with the Atlanta Track Club some runs, and had some foot pain and plantar fasciitis over the years. However, uh, it's one of those things that I try to be a doctor to myself, but I definitely try to reduce some of the stress and overload at times, continue to incorporate different treatments from a therapeutic aspect, and trying to avoid surgery most importantly.
Is it true that health professionals are the worst patients?
We are the worst. Not only have we already diagnosed ourselves, but no one can tell us anything else or what to do.
Ever have patients like that?
All the time.
So as far as pain goes, it's not just, I think a lot of people think pain management, or the name even of the group with Georgia Pain and Spine Institute, is that you deal mainly with back pain, neck pain, maybe motor vehicle accidents. But that's not the only source of pain that most people deal with, right? With in talking to you, cancer is one of those things that you have taken kind of, I dare to use the word, a liking to, but a passion to help people who have that kind of disease and get past that pain. So what is that motivation? What is that that type of treatment? What would you say to somebody who's experiencing pain as it relates to cancer, and about the things that you can do here to help?
So, cancer is one of the most devastating uh, illnesses, diseases that you can have. And the great thing is that there's treatment available. Unfortunately, some of these treatments, some of these medications, some of these drugs have side effects. So, a lot of times, individuals are not only dealing with the pain of having cancer, but also the pain from the side effects of some of these medications. Here at Georgia Pain and Spine Institute, we take a comprehensive approach to treating pain. First and foremost, comfort is our goal. And so we want to be able to provide some relief overall from the actual cancer itself, but also from the potential side effects of the medications. Um, we have individuals that have significant nerve related um, illnesses or nerve related disease states from the chemotherapeutic medications. And we try to find a right mix between pain medication, interventions, and other treatments overall to not only help reduce the pain as one goes through treatment, but also provide a positive outlook and to help someone who's going through treatment get through treatment and as much comfort as possible.
Great. What about things, more chronic diseases, things like rheumatoid arthritis, osteoarthritis? What are some of those things that are, more bone and joint related that people would suffer from a pain standpoint?
So we have the capability of treating all types of pain, but also specifically extremity related or joint related pain. Um, you mentioned rheumatoid arthritis. It's a severe anti-inflammatory disease state, and individuals that suffer from rheumatoid at various stages have significant pain. We work closely with those doctors, specifically rheumatologists, and try to come up with a comprehensive approach. There are some medications that the rheumatologist can prescribe that can help suppress some of the immune response. However, in addition, there are different treatments and medications that may be available to help those with chronic, long-standing, progressive disease states such as rheumatoid arthritis.
So there's a push towards I think not taking as much medications. We see TV commercials that say take this medicine helps this, but it might cause a laundry list of other stuff. So I know CBD oil is one big thing, but are there some other alternatives to some of these heavy medications that people are taking that maybe don't allow them to drive or go to work? What are some alternatives that they could take that would be better?
So CBD is one of those areas and one of those we would like to call them medications, if we could use that terminology. It's one of those avenues that potentially have the benefit of reducing pain. Um, Again, it's not a cookie cut approach. What may work for someone may not work for someone else. In regards to CBD or CBD oil, it's usually the oil without THC. There are many different mixtures they can create, such as it could be in a salve, it could be in a roll-on as a perspirant, antiperspirant type of product. There are even some sublingual formulations of it. One of the big things is to know what company is producing the product. There needs to be a standard in their lab of how they mix and create the medication. In addition, you want to ensure that this company has all the rules and regulations in the U.S. that they've followed, and that specifically includes without THC. Again, for some individuals, it works great, and then for some individuals, it doesn't work as great. However, I do believe it has the benefit of being a great adjuvant to help reduce pain overall. And I think the more individuals and more physicians and the medical community as a whole is becoming more open to its potential beneficial use.
Love that. And then lastly here, as far as hospitals and your office, and if anybody has to have any procedures done, how does that work for you?
So here at Georgia Pain and Spine Institute, We're a inclusive practice where we attempt to reduce your need from going to multiple different uh, offices to have facilities, or multiple offices and facilities that have procedures performed. We have a in-office procedure suite where we are able to perform our procedures if need be. If we need to provide sedation, we have that capability. And if we need to provide deep sedation, we also have that capability. There are times and different situations that are emergent where individuals or clients must go to the hospital. However, for non-surgical, non-operative interventional procedures, such as what we do here at Georgia Pain and Spine Institute, we are able to provide comprehensive care and a family-friendly type environment. And we do have the ability, if need be, to have individuals seen at the hospital. Uh, but overall, we can take care of all your needs.
And I hear you talk about the family environment, and a lot of times I don't hear you refer to the people that come through your door as patients. A lot of times they're individuals or clients, which I love that. Tell me a little bit more about that language and why you seem to be so specific and getting away from calling people patients.
Well, we are a client, family friendly, owned type practice. Um, I believe that in order to be able to to get to the root of someone's ailment, or to be able to treat someone, you have to treat them as family, as I would want anyone to treat my family, or my mother, or my father. I would want to be able to walk into a facility and be put at ease and be comfortable. And here at Georgia Pain and Spine Institute, we like to provide that. We like to know everyone on a first name basis. We like for their family to come with them, because someone undergoing or having significant pain, it's important to know that not only does it affect that individual, but it also affects their family also, because they're the ones caring, and they're the ones that are seeing their loved one go through such discourse. So we like to bring the family in, and we like to ensure, or we like to hope that we ensure that individuals will get great relief, and also we help heal the family too.
Sounds like a lot of the approach when it comes to pain is not so much about the physical side, but also the emotional and psychological toll that it takes on a person. So, tell me a little bit about your approach to that, and how that family environment can help with those more emotional and psychological portions of what you offer here.
So the emotional psychological aspect of having chronic pain or even acute pain go hand in hand. One cannot actually undergo or deal with pain and not have that affect their whole aspect of their life. Once an individual has pain for a certain period of time, it actually becomes them. And what we like to do is to attempt to break that cycle. Uh, if we're able to get the pain under control, we also will then work towards getting the psychological and emotional aspect. And one thing that I find most beneficial is that with family, individuals have a bedrock, they have someone to lean on, and they have someone to help provide that support. One man, one woman can't do it alone. And as one unit, what I like to believe, the family, the client, and our team here at Georgia Pain and Spine Institute, being a one unit, we can overcome all difficulties and help you get to um, a significant reduction in pain and overall increased quality of life.
And last question, Dr. Webb, you are one of the few people who have a double board certification, correct?
Yes, so double board certified in anesthesiology and chronic pain medicine, and uniquely one of the few that double fellowship, where I did a fellowship in acute regional pain medicine at the University of Pittsburgh Medical Center, and my chronic pain fellowship at the University of Iowa.
And how does that separate you from, say, other pain management facilities?
Well, I always wanted to be able to not only take care of the client and the outpatient setting, but also acutely in the operative room and also post-operatively, so outside of the hospital. And what separates us and what makes us unique is that we can see um, anyone from A to Z. We can see any ages, and we have the ability to see individuals and clients the day of. And I think that what makes us a little unique, that we can bring all that in house and to be able to provide good comprehensive care.